Hi, my name is Dr. Tom Lewis, founder of RealHealth Innovations. I'm a medical scientist and I have a credential from the Harvard School of Public Health and a degree from MIT. RealHealth Innovations is a health creation company. What we do is we help people prevent, stop, slow, or even reverse chronic conditions. I'd like to explain to you now how RealHealth implements this program in a personalized basis for anybody depending on where they are in the health disease continuum. So what we do is, for those who are truly healthy or are looking to get healthy, they're pretty healthy, we provide a health optimization program. We also provide a mitigation program. A lot of folks will say they have a disease management program. Our disease management program is much more advanced than that, in that we don't want to just manage the disease, we want to get to the root cause and actually mitigate or reverse the condition. Now on the next slide, here's Harvard Medical School and the New England Journal of Medicine saying we really need to figure out how to make healthcare delivery not one size fits all. We have to understand where people fall in the health disease continuum. And this is pretty consistent across any population. There's a few that are the highest cost, and most of us, fortunately, are fairly healthy. But each individual, the highest risk individual, came from a lower risk and lower cost pool at some point. So I'd like to cover each category. So if we look at the 40% that are truly healthy, what we're trying to do with these folks is make sure they stay healthy. So they need very low touch. It's low cost to keep these people healthy, but the benefit of keeping them healthy is they're not going to fall into the next higher category. The next are what we call the apparently well or the apparently healthy. These people may have some minor aches and pains, and they're starting to become consumers of the healthcare system, but they really probably have something underlying that's underdiagnosed in the healthcare system today. We tend to wait till someone actually has a diagnosis, a disease, before we treat them. But these people, that disease, particularly that chronic disease, is brewing. They need a little more care. They're low risk still, but they need a little more care. So they may have a health coach and work through some basic actions with a health coach to keep their health under control and actually move them into the truly healthy category. The next category is the medium risk. This is 20% of the population. They're on meds, they're on the cholesterol med, they're on the blood pressure lowering med. They have a diagnosis or two, and currently they're seeing a doctor every 6 months, checking their cholesterol, making sure they're taking the meds, and that's about it. What these people really need is they need some coaching. They need to have the underlying causes of their need for a cholesterol med or a hypertensive med evaluated and worked on. And so many times it can be corrected just through lifestyle modifications, so with a health coach. The next group, and I broke this into one big group, but really 8% of the population is at high risk, and then 2% are at the highest risk. And these folks are costing the healthcare system, whether it's a self-insured company or a municipality or Medicare, 40% of the healthcare spend. So what these folks need is intensive, higher touch. So yes, they're going to be seeing a physician, but they also should be seeing a health coach, because to get into a disease state, they had a number of lifestyle, behavior, and environmental risks that contributed to that. So if we just medicate them, that's not a solution. We need to also identify their risks and help them mitigate their risks. There's no simple cure to these types of conditions. It's eliminating a number of simple risks have a profound effect on people's health. So it's all about providing real care and the right care. So the truly healthy people are just going to take the RealHealth living profile, identify risks, carry out some actions, may have a little bit of coaching, but really can self-serve to keep themselves in a very healthy state. This next group, they take the profile, which is an HRA, a health risk assessment tool, get some actions to follow out based on their risks. They get some consistent coaching, maybe a couple hours a year, can actually move them back down into this bracket. These folks need more medical care. We may do biometric screening on these folks, coaching, some doctoring, maybe a couple hours at most a year, put them back into a better state of health. And these folks that are normally put into the care of a specialist, they need coaching. We need to eliminate risks. So just like these folks here, they have risks, they have risks. These people have more risks. Work on risks, identifying risks, correct them with actions, measure their blood. They may require advanced diagnostics. So they're going to need more coaching and more doctoring time. This is the new model for healthcare. So the reason why I emphasize coaching and eliminating risks is this is a quote from John F. Kennedy. The rising tide lifts all boats. Everybody needs to have their risks identified, not just their disease managed. And when you identify risks and ameliorate those risks, you'll find that many chronic conditions that people are suffering from will be rectified. My name is Dr. Tom Lewis, founder of RealHealth Innovations. We're a health creation company. Thank you very much for your time.